Hi everyone. So today we are going to learn about the attachments of norma lateralis. The anatomy of norma lateralis we have learned in the previous video, and the attachments of norma lateralis were remaining. So today we'll be learning about them. So basically there are these structures which are seen in norma lateralis. First is the temporal fascia. So this yellow colored structure above is the temporal fascia. This attaches to the superior temporal line and the area between superior and inferior temporal line. So temporal fascia is superiorly, it gets attachment from the superior temporal line and the area between superior and inferior temporal line. Then it covers whole of the temporalis muscle, and inferiorly it gets attached to the upper border of the zygomatic arch. So superiorly, the temporal fascia has a single layer. As it runs inferiorly or it runs downwards, it splits into two layers, and those two layers they gets attached to the inner lip and the outer lip of the upper surface of upper border of zygomatic arch. So inferiorly, the temporal fascia has two layers, and these two layers are usually separated by fat and vessels. Second structure which we can see in norma lateralis is the lateral ligament of TMJ. So this is the lateral ligament of TMJ, which gets attached to the articular tubercle of the inferior border of zygomatic arch. So inferior border of zygomatic arch has a tubercle-like structure in front of temporomandibular joint. So this lateral ligament of temporomandibular joint gets attached to this articular tubercle. Then two muscles which gets originated from norma lateralis is first is the temporalis muscle. So this is the temporalis muscle, and second muscle which gets originated in norma lateralis is the masseter muscle. So these two muscles gets originated from this surface of the skull, and three muscles which gets inserted into the norma lateralis. The first one is the sternocleidomastoid. Then second one is the splenius capitis. And last is the longissimus capitis. So these structures which are attached to norma lateralis, first is the temporal fascia, second is the lateral ligament of temporomandibular joint here, then origin of temporalis muscle, origin of masseter muscle, and insertion of sternocleidomastoid, splenius capitis, and longissimus capitis muscle. So these are the attachments of norma lateralis. Coming to temporalis muscle, the origin, as we have already seen, that the origin of temporalis muscle, it gets originated from the temporal fossa. Whole of the temporal fossa except for the portion which is formed by zygomatic bone. So this whole temporal fossa gives origin to temporalis muscle, and it gets inserted into the coronoid process. This is the coronoid process and anterior surface of ramus of the mandible. So here this temporalis muscle gets inserted. Next is the masseter muscle. Masseter muscle takes origin from the medial surface, that is the inner surface and lower border of the zygomatic arch. Lower border of the zygomatic arch and the inner surface or the medial surface of zygomatic arch, which is present towards the skull, the inner surface. And then the fibers run downward and backward, and they gets inserted into the lateral surface of ramus of the mandible and angle of the mandible. So the origin of masseter muscle is from the lower border of zygomatic arch and the medial surface of zygomatic arch, and the insertion is at the angle of the mandible and the lateral surface of ramus of the mandible. Next is the sternocleidomastoid muscle. So sternocleidomastoid muscle, as the name suggests, it gets originated from the sternum and the middle one third of the clavicle, and then the fibers run superiorly and posteriorly, and it gets inserted into the mastoid process, lateral surface of the mastoid process. Coming to splenius capitis, it gets originated from the spinous process of C7 and the T1 to T3 vertebra here. So here is the spinous process of C7 and then T1 to T3 vertebrae and the nuchal ligament, and then it runs superiorly and anteriorly, and it also gets inserted into the lateral surface of mastoid process just below the sternocleidomastoid muscle. Coming to longissimus capitis, it gets originated from the transverse process of T1 to T5 vertebrae and articular process of C4 to C7 vertebrae, and then it goes superiorly and gets inserted into the lateral surface of mastoid here. So these are the three muscles: the sternocleidomastoid, the splenius capitis, and longissimus capitis, which gets inserted into the mastoid process of temporal bone. Now there are few foramens present in the norma lateralis, which we have already seen in the previous video of anatomy of norma lateralis, and the structures which passes through these fissures and foramens, which that we have to see. So first is the tympanomastoid fissure. Tympanomastoid fissure is present between the tympanic process of temporal bone and the mastoid process, somewhere here between the external acoustic meatus and the mastoid process, and it transmits the auricular branch of vagus nerve. So here it transmits the auricular branch of vagus nerve. Coming to mastoid foramen, as we have already seen that mastoid foramen is present usually on the course of occipitomastoid suture, but it may also be present in the occipital bone, towards the occipital bone. So this mastoid foramen, it transmits an emissary vein and meningeal branch of occipital artery. So two structures pass through this foramen, that is the emissary vein, and second is the meningeal branch of occipital artery. And the last foramen which is present in norma lateralis is here. It is the zygomatico-temporal foramen. So zygomatico-temporal foramen is present towards the anterior one third of the zygomatic arch. So it transmits the zygomatico-temporal nerve and also a minute artery. So these are the major attachments of norma lateralis. Of course, the attachments which we have already seen in norma frontalis, like procerus muscle, these muscles can also be seen in norma lateralis, but the structures which can exclusively be seen in norma lateralis, that we have discussed in this video. So as of now, the attachments of norma lateralis is finished. Thank you so much for watching this video, and we'll be proceeding with norma basalis in the next video. Thank you.